When you receive a concerning diagnosis, it can shake your confidence. That's why getting a second opinion may help.
As part of our Ask the Expert series, 7 News anchor Kelsey O'Donnell spoke with a doctor from Bon Secours about when to consult with someone else about how to go about this.
When a doctor confirms a new diagnosis,
it changes things.
Life as you know it could change. According to health experts, diagnoses are presented in different forms, including disorders, illnesses, and diseases, which is why opinions when determining treatment options matter. Dr. William Lawrence specializes in cancer.
In most people's lives, that's kind of the most significant healthcare event they've had. And the initial treatment for any type of cancer is very important. You want to ensure that you're treating that cancer in a guideline appropriate. You're following national guidelines and it's being treated correctly.
Those treatment options can vary whether it's cancer or another disease. Doctors say getting a second opinion could be beneficial to assure you're receiving the most accurate and effective plan. After all, the cost, length of therapy, and location are all under the microscope.
We encourage people to go get a second opinion if they want to. Now, the reality is not everybody wants to.
But what if you're afraid of offending your doctor?
I've heard stories of some people, some physicians maybe getting upset. I tell patients that's a warning sign. If somebody they're not okay with you getting a second opinion, then that would make me question.
Regardless of whether you decide to get a second opinion or not, doctors say it's a decision the patient needs to be comfortable with.
I encourage my patients, if they see me as the first opinion, I encourage them to get a second opinion. You've got to be comfortable with the physician, you've got to be comfortable with the treatment plan, because after all, it's your life and you want to make sure you're getting the best information possible.
And while some seek out 2, sometimes 3 opinions to weigh their options, doctors say more is not always better.
It's the kind of old saying, too many cooks in the kitchen ruin the stew. Listen, I did my fellowship at Memorial Sloan Kettering in New York, and there were some patients that I saw there that were on their 5th to 6th opinion on how to treat their prostate cancer. I personally think that's overkill.
But if that's what you need, then doctors say go without hesitation.
Patients, they need to do what makes them comfortable.
For this week's Ask the Expert, I'm Kelsey O'Donnell.
And remember, you can always submit a health topic for our Ask the Expert series. Head to our website, click the News tab, then Ask the Expert. Doctors